This is Dr. Duke Majan. It is May 29, 2025. It is our last day of surgery for the month of May in the year of 2025. We have a full day of surgery today. We have 5 surgeries, and each patient is having multiple areas fixed. And for those of you who join us regularly, you've seen most of our animation videos, and you understand that there are 30 specific causes of back pain, chronic back pain. Chronic back pain is back pain that people have that lasts more than 4 weeks. And it can come and go, but it's still considered chronic if it keeps coming back. So chronic back pain has 30 specific causes. And I want to share those 30 causes with you so you can understand this patient's causes. He has 3 discs, 2 SIs, 2 piriformises. So what is that? 3, 4, 5, 6, 7, 8, 9, 2 facets. So we have 9 different causes of back pain in this patient who's had back pain for 20 years. He comes to us from a very far off place, Alberta, Canada, correct? Yes. And he heard about us through friends that have been treated here successfully at Duke Spine Institute. Duke Spine Institute is leading the world in curing back and neck pain. All right, did we already do a little num-num? Good. I am going to do the discogram, but it's not as important for confirmation. We're going to start. We've got L23, L45, L5S1 discs. I'm going to get the L45, L5S1 with the lower needle. I'm going to get the L23 with an upper needle shot. All right, can be a little bit higher. Now the reason we have a large part of his back prepped out is because we have a lot of work to do on his back. We're going to be fixing a lot of things. Shot. Henry, in the meantime, let's show the audience those 30 causes of back pain. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L45, followed by L5S1, then L34. The L12 and L23 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L12, L23, L34, L45, and L5S1. The most common facet joints to cause chronic back pain are L45, followed by L5S1, followed by L34, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. And welcome back. You can see from our animation there are many causes of back pain, but the most common, number one cause in 85% of patients is the disc. And this patient has 3 discs that are damaged that are causing his back pain. The other causes include facet joints, and this patient has 2 facet joints at L5S1, definitely causing back pain. We're going to fix those today with our Duke plasma rhizotomy. He has the SI joints, left and right, causing back pain, so that's 2 more. And he's got the piriformis muscles in both butt cheeks causing back pain. So we're going to fix all this, but we're going to break it up into multiple streams. Are you comfortable?
How are you doing?
Any pain?
You have any pain? No, you said no.
All right. Now, how bad is it?
Give us a number, 1 to 10. What number did you say?
9 or 10. I think I heard 10, yeah. All right, is it better now? So L23 is 10 out of 10. Is that where you get your back pain?
Is that where you get it normally? My friend? Yes.
All right, good. How bad is that on a scale of 1 to 10? What's the highest? 9? All right, is that where you get your back pain?
Yes.
Concordant, 9 out of 9 at L45. Good job, we're almost done. We're going to put you to sleep soon. How bad is that on a scale of 1 to 10? How's the highest it goes?
Give us a number.
10. All right, is that where you get your back pain? Okay, we got 10 out of 10 at L23, 10 out of 10 at L5S1, and 9 out of 10 at L45. You get to go to sleep now. When you wake up, we'll be done with your surgery. Everything's going very well. Just count out loud for us from 1 to 100 out loud so we can hear you. All right, so we got great news. We tested all 3 discs. All 3 discs are causing his typical back pain, and we're going to fix these 3 discs first, and then his back pain will be gone. Now he's still going to have back pain from the facet joints, but we're going to fix that next. So by the time we're done today with all the treatments he's getting, there will be no more back pain. He'll have a little bit of soreness from the surgery, but that chronic back pain he's had for 20 years will be gone. That's what Duke Spine Institute is able to do. Yeah. Any questions from the audience, Henry?
At this moment, no current questions.
Shot? Let's go, Jordan. So at this point then, let's show the audience how a disc injury, can you bring the window down a little please so my hands don't get radiated? How a disc injury causes so much back pain and how we fix it here at Duke Spine using a laser. It's a revolutionary technique not available anywhere else in the world.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A quarter-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Back. Thanks. You can see, so room 2. Yes. You can see from our video there, folks, that the disc injuries cause back pain through a process called inflammation. Inflammation is the cause of back pain. Is the most common cause of back pain. It accounts for basically 100% of back pain, chronic back pain, 100% of chronic back pain. Whether it's inflammation coming from the disc, which you just saw how the disc injury causes chronic back pain, or it's inflammation coming from the facet joints, which we'll show you shortly, or it's inflammation coming from the sacroiliac joints, or it's inflammation coming from the piriformis muscle, the coccyx ligament, coccygeal ligament, or the fracture in the vertebral body. All of these mechanisms hurt the patient through a process called inflammation. Now, inflammation is an old system in our body. It's been around for a long time, and it's basically a defense system. It's there to defend your body from foreign invaders. Foreign invaders such as bacteria, fungus, protozoans, not viruses, but there is an indirect response to cell death that the viruses cause, and therefore your inflammatory system does get activated when you get viruses, but not directly against the virus, against basically the dead tissue that the viruses cause. So it's an old defense system called the inflammatory system. We have a newer defense system called the immune system. We have really two defense systems. They're like the two branches of the military, if your body had two branches of the military, and one is much more sophisticated than the other. But the inflammatory system was really our first what's called humorally mediated defense system. Humorally mediated means it travels through your bloodstream to get to different locations. So it uses your highway system of your body, which is your blood circulation system, arteries, veins, capillaries, to kind of go around and look for problems, right? So once it sees a problem, it attacks. It usually shoots first and asks questions later. That's the inflammatory system. Not very intelligent, but it is very intelligent by design. It's just lacking what we call specificity. Specificity is being specific for something, and it would be nice if it was a little more specific, just targeting bacteria, protozoans, and fungi, but it's not. It actually attacks your own tissues, like the herniation. Now, the inflammatory system can't be blamed for attacking the herniation because, let's face it, the herniation is nucleus pulposus, and your inflammatory system has never seen nucleus pulposus before until you get a herniated disc. Then it sees it for the first time and it attacks it. Because the nucleus pulposus is made from a very special tissue called the notochord, embryologically, and the notochord is not visible to anything in your body because it's hidden in the middle of your avascular disc. The disc has no blood supply in the middle where the nucleus is. And this is, of course, by design. Because that nucleus is so pro-inflammatory, it elicits an inflammatory response that's so strong that evolutionarily we hid the nucleus away in the middle of our disc, never to be seen, never to be bothered, never to be pestered with. If you ever watched Harry Potter, was it Harry Potter? No. Sorry, Lord of the Rings. The Lord of the Rings, you remember when the good guys captured the evil Sauron and his cronies and buried them away in the mountain in a crypt that was never supposed to be opened, right? But somebody came along and opened it and let them out. I think those were the wraiths they let out. Anyway, long story short, the nucleus is just like those bad guys, hiding away, buried in a crypt, the center of your disc, never to be let out, never to be exposed to your inflammatory system. And then one day you get into an accident, you tear your disc, and next thing you know, with that tear, which you guys are looking at the tear right there, that is the tear. You guys see it?
Yes, we do.
You got that blue stuff sticking out? That's the nucleus. That's the herniation. So that tear allows the herniation. The herniation coming out of your center of your disc, it gets exposed to your inflammatory system, which it then creates an inflammatory response. And that inflammatory response causes pain. It activates nerves, pain nerves in the surrounding tissue, which is the tissue around the back of the disc called these are branches of the sinovertebral nerve. They are somatic afferent fibers. They transmit to your brain, to a part of your brain that says, hey, my back is hurting. I know exactly where it's hurting. It's the L5S1 disc. All right, so my point is, all of this back pain that we've been mystified by in medicine for the last 200 years, Duke Spine Institute, actually myself, I elucidated, discovered, shed light on the mechanism of localized pain in the back. And every cause of back pain can now be cured by one of our treatments at Duke Spine. But you will not find cures anywhere else in the world because everybody else is still living in the past. All these other doctors, therapists, chiropractors, pain management docs, spine surgeons, orthopedic surgeons, neurosurgeons, you name it, they're all living with the belief that back pain cannot be cured and it does not have a specific cause. But it does have a specific cause. You guys just saw that video. And we looked at one of those specific causes, which is the disc. Okay? So, back pain has specific causes. We are the first in the world to publish those specific causes. And we're publishing them every time we show these videos because we're talking about those 30 causes that are specific in our video. Okay? Any questions?
Yes, we have a question coming from Maximus8992 on YouTube.
Oh, I like that name, Maximus. I almost named my son Maximus, but my wife wouldn't let me. All right, go ahead. Let's hear the question from Maximus.
Asking, would a microdiscectomy help after 8 years of back pain?
No, microdiscectomy does not fix back pain. Do not do a microdiscectomy for back pain. The only reason surgeons are recommending microdiscectomy these days, the vast majority of the time, is so they can take the bones out of your back so that your back becomes weak and hurts more. and then you're going to be begging for them to do what's called a fusion. Their goal is to do a fusion on you. But to get you to agree to a fusion, they first have to do a microdiscectomy. Once they do a microdiscectomy, they can get the insurance to agree to a fusion, but they can also get you, the patient, to agree to a fusion. It's a scam. Do not do a microdiscectomy for back pain. The only thing microdiscectomy has ever been shown to help is pinched nerve symptoms, which is leg pain, weakness, numbness, tingling in your leg. Only leg, no back pain. Microdiscectomies don't fix back pain. All right, there is the tear. You guys see it? It's got a faint blue coloration.
Yes, we do.
You have the torn annulus on the right, torn annulus on the left, and in the middle, you got the herniation stuck in there. And that herniation is what's causing all the inflammation and back pain. It's been there for a long time, all right? So I slowly am working my tube backwards, exposing more of this tear, and I'm using the laser to do a debridement. Microdiscectomy, by the way, does not use laser technology. It uses primitive, like literally, you remember the old cavemen used to go around with a club, beating each other over the head with a club? That's how microdiscectomy, that's how I see microdiscectomy today in 2025. It's like a primitive weapon trying to be used to obviously either intimidate or do harm to your opponent. But microdiscectomy is like that club that the cavemen used to use. What we have here with the laser, it's really like the ultrasonic missile system with missile guidance. It's the most advanced system in the world for back pain. You guys are watching the most advanced. Why would you ever want to go back to using a billy club or one of those tree branches to beat your opponent? You don't. Okay, if you have to fight somebody, you don't want a club. You want something a little more sophisticated. And by the way, we're not talking about fighting people here. We're talking about fixing someone's back. So why would you ever want to do something that doesn't work for your back? You shouldn't. The problem is these other doctors are going to tell you to do microdiscectomy because number one, they don't know how to do laser surgery like we do. Number two, they don't have the equipment to do it. So even if they want to do it, they can't do it. Number three, they don't have the training to do it. So they don't know how to do it even if they wanted to do it. Okay? Laser surgery is the future of spine surgery. You're just seeing it here at Duke Spine first because we pioneered this technology. But it will be used by everybody in the future. It's cheaper than other types of spine surgery, and more importantly, it's definitive. Definitive means this surgery is a permanent fix. You come and get this done, and the pain goes away permanently. It never comes back. Never. So the only way for it ever to come back is if you re-herniate your disc, which is very rare, but it can happen. 1% of our patients will re-herniate doing some strenuous activity right after surgery, usually. They don't follow our instructions. We tell them to take it easy for the first year and just sort of jog and not do too much heavy lifting. But some people have to go back to a job that requires heavy lifting or whatever it is they're doing, it's super physical, and they end up re-herniating. So our re-herniation rate is 1%, but it's always because the person didn't listen to us. All right, we're just about done with our first disc. This is the L5S1. It's the hardest one to do. The other ones will be a little bit easier, only because of the anatomy. But the inside of the disc, we're seeing a lot of scar tissue right here. You guys see that white stuff? It's super thick, and it's calcified. It's getting calcified. That's why we see the gold coloration of the tissue. When the laser hits it, it turns gold color. But we're just about done here at L5S1. Got about another minute here, and then we're going to move on to L45, and we'll finish up with L23. And then we're going to end the stream. We're going to bring you back for the SI joints because he has sacroiliac joint pain as well. We're going to fix that with our Duke plasma rhizotomy. Any other questions?
No current questions, but in the meantime, why don't we
show the microdiscectomy?
Exactly. Well,
Since
perfect.
we had a question on it.
Exactly.
I read your mind, Henry.
Perfect.
A large incision is made. Muscles are torn from the spine. Substantial bleeding occurs due to muscle trauma. Normal, healthy bone is removed to access the herniation. Stabilizing ligaments are removed in order to access the herniation. An incomplete portion of the herniation is removed. Dense scar tissue forms. Weakened bones can fracture, leading to instability and pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
Well, you can see from our microdiscectomy video that microdiscectomy shot is a type of surgery that is highly destructive. It's an old surgery. It's been around for almost 100 years. And it started out as discectomy, then it became microdiscectomy. I was trained to do microdiscectomies in my training back in the 90s. It was a common surgery done for a pinched nerve root, causing leg weakness, numbness, tingling. It's still common today, and unfortunately there's better treatments available now, but most surgeons don't know how to do these better treatments. They're not trained in them. They're trained on microdiscectomy. So our training centers are way behind, unfortunately, in the technology in America, but around the world as well. Endoscopic surgery, transforaminal endoscopic surgery is the very best. And it's now being done in China, Korea, Germany. However, nobody does it the way we do it. They just use metal grabbers to pull the herniation, but they don't actually use a laser to clean the tear. That is my discovery. I'm the first in the world to do it and the first in the world to publish it. It's called an annular debridement. It's that debridement that allows the disc to heal properly and not reherniate, not cause back pain. We do the same procedure in the neck for cervical spine, which we actually have a cervical case today. For those of you who want to see the neck, the cervical case will be C3445 or 45. So that's going to be after this case. We have one quickie in the other room, and then we're going to do the cervical. So you guys are going to get to watch a cervical Duke laser disc repair today. We're actually doing quite a bit today. We're doing a lot of lumbar procedures, and we're doing one cervical. Last week we did a thoracic facet. This disc should be quick. It doesn't have much disc material or herniation. There's a little bit there at 12 o'clock. You can see. Any questions?
At this moment, no current questions.
And you tagged and titled good, so you got viewership?
Of course. Always,
All right.
yeah.
Well, it's okay not to have questions.
We just got a question coming from Charlie on YouTube,
Hi, Charlie. Welcome.
asking, are you aware of any evidence that shows the use of stem cell material being introduced can help with healing of the annular tear after debridement?
Yeah, it's a great question, Charlie. So Charlie is asking about using stem cells to help heal the annular tear. So number one, the stem cells will not stay where you put them. So let's say I put the stem cells right here where I'm operating. The problem is they're going to leave this place. They're going to come out around the nerve root and escape. There's really no good way to hold them there. And even if you did hold them, put them in a cage or put them in a basket or a matrix of some type, then that matrix will push out and hit the nerve root once again. People have tried it. I don't believe stem cells are necessary. I think you're gilding the lily. If you put stem cells here, I think you're only asking for trouble. Now, we've done stem cells in the past, here, in the back, and all it did was delay the healing of the wound by the patient. The patient was in severe pain from the stem cells, because stem cells, most people don't understand, they're pro-inflammatory. They cause inflammation. Well, remember, inflammation is the reason we're doing this surgery, to get rid of it. So why would we want to put something in there that causes inflammation, albeit temporary inflammation? So stem cells work by causing temporary inflammation. We don't want that. It creates a lot of pain and suffering after surgery that's unnecessary, and I don't see any benefit at all. Your body will heal this disc on its own. It doesn't need any help. Now, there is one thing that I'm going to be introducing to help heal the disc, and I've talked about it a few years ago. But I'm filing for a patent on it, and I don't want to let the cat out of the bag too soon, so to speak. So once I get my patent, which is imminent, then I will talk to you more about it. We're going to discuss it more. We're going to see it more, okay? And I'll give you a little hint. It has to do with nanotechnology. Nanotechnology. Pretty cool stuff. All right, we are done. Moving on to the next disc. There wasn't much to do on this one, but it was definitely a painful disc, that's for sure. By the way, we've lost literally about 5 cc's of blood so far. Not 5 cc's, sorry. About 1 cc of blood so far, which is very little. 1 cc is 1 ml, which is 20 drops. So 20 drops of blood so far, which is nothing. That's one of the advantages of our surgery, the Duke Laser Disc Repair. It's a bloodless surgery. You're not losing any blood. Other types of spine surgery are bloody. And another advantage is because we're not doing any internal trauma, we're just cutting the skin, there's no internal damage to the patient. There's no collateral damage. Like with open spine surgery, laminectomy, microdiscectomy, fusion, artificial disc, the surgeon is wreaking havoc inside your body. All you see is a little cut, but inside he's ripped your muscles out, ripped your ligaments out, ripped your bones out. I mean, just destroyed your body internally. And then they close up the incision, so all you see is a little cut. But what you don't see is the massive, Nagasaki, Hiroshima damage to your body underneath your skin. But you feel it, and that's why people who have open back surgery, they're in pain, horrible pain, for weeks and months afterwards. You guys have all heard about that. I'm not the first person telling you this. But with Duke Laser Disc Repair, there's no pain, and our patients don't take any painkillers after surgery. This is the only spine surgery in the world where you don't need narcotic painkillers. So remember, narcotics are bad, they're dangerous, you don't want them in your life. And this surgery lets you have back surgery without narcotics. So our surgery is safer during the surgery, it's safer after the surgery, it's also less invasive, it's also no metal or biologics put in your body, no cages or artificial discs or any junk, no stimulators. It's 100% cure of your disc pain every time. That's our average, is 100%. And it's outpatient. You get to go home right after your surgery. Good thing we're done. No, but we don't need it. Will you find that?
Sorry, yeah. I got wiring. That's right here.
All right. Any questions?
Yes, we have a question coming from Lanu on YouTube.
Lanu. Yes, I think we're in.
Asking, I have a prehistoric question. Is it possible for dinosaurs to have back pain?
Yes, of course. Dinosaurs had spines, they had vertebrae, they had discs. They certainly could have back pain. I'm sure that some of them had back pain. It's quite a good question.
Protozoans do not have back pain.
Yeah, bacteria doesn't have back pain. And fuck it. My wife says stay apolitical, but I can't help it. Liberals don't have back pain either. They're spineless. All right. Sorry. I had to do it, guys. Frankly, I don't care. They need to know the truth. I know that's going to generate some hate mail. Some hateful comments. But I can't help it. It's so damn true. They've put our country back 100 years. With all their lying, cheating, and stealing. All right. Any other questions?
At this moment, no current questions.
We have 5 surgeries today. It's a busy day for us. And this surgery is our most involved and I want to say this because I think it's important for people to know. We were just talking about how safe this surgery, the Duke laser disc repair, is. It's so minimally invasive, no bleeding, no post-operative narcotics, and in 20 years of performing this surgery, we've never had a complication from the surgery. So we've never had a surgical complication. Now, it's such a safe surgery that we can take patients that have serious medical problems like diabetes or high blood pressure or even lung transplants, like this patient has a lung transplant, and we can do their surgery, okay? Now you probably wouldn't even have guessed this patient has a lung transplant if I didn't tell you, but he did. So, you know, he's a patient with a serious comorbidity that no other doctor would probably operate on because they're afraid of the lung transplant and that causing complications. But this surgery is so safe that even a lung transplant patient like this patient can have it done. Duke Spine Institute provides patients the safest, most effective treatments in the world for their back and neck pain. Any other questions?
Yes, we have another question coming from Lanu once more on YouTube.
All right, Lanu.
Saying we are looking forward to seeing the Spine Scam movie. Hopefully will be released officially this year.
Yes. Well, great question. So the Spine Scam movie she's referring to, we had a showing, and I think it was well received. People liked it. We are trying to figure out which streamer is going to get it. And that's a question I had for you, Henry. What is the biggest international streamer? What streamer has more like streaming than any other streamer?
100% Netflix.
You think so?
100%.
All right.
I can look up the list, but I am 98% sure it's Netflix.
More than Hulu?
More than Hulu, more than Disney Plus, and Hulu combined because they're...
HBO Max is up there, though.
Yeah, HBO Max, Prime, Apple TV.
Ah, Prime.
So, but I could
forgot
definitely
about
look up the
Prime.
list.
Yeah, I would like to know who's number one with the most streams in the world. Not just America, the world. All right, we got 5 minutes on this disc. Is he awake? Almost done.
Netflix with over 270 million subscribers. Prime with 250 million. Disney with 180 million. HBO Max 100 million.
You said Amazon Prime is 270?
The Netflix is 270. Prime is 250.
Yeah, but Prime, I mean, like you get a free subscription if you're Prime, right?
If you sign up for Prime, I think you get like a 30-day free trial or something like that. But yeah,
No. I think Prime gets Amazon for free, right? So,
oh yes, correct.
So Amazon is kind of cheating because Netflix, it has 370 people that literally sign up just for the streaming. But Prime, they automatically take you, if you shop and you buy a lot of stuff, they put you in the Prime subscription.
Exactly.
So there may be a bunch of people in Prime that don't actually watch, whereas all the Netflix people would be watching.
Exactly.
Interesting.
Because Amazon is more than just their streaming service. They're Amazon, you know. So.
Right. So they get all these people to shop, and they get him signed up for Prime for free shipping, and then they stick him in their Amazon Prime subscriber of their, whatever. Their shows.
Yeah. Exactly.
So really, it's probably Netflix, and then who's after Prime?
Disney Plus.
What does Disney Plus have?
Disney Plus, they have Hulu and ESPN. When it comes to surgical stuff, I don't know if that would be when it comes to just our movie and everything. I don't know if that would be for them specifically, because they're just more family oriented, and I just know how Disney's content is, and they try to stick with their own agendas and everything, and so it's just I say not to aim towards that, but it's an option for sure.
You guys gotta watch The Last of Us this weekend. Excellent. Have you seen The Last of Us, Dr. Dick?
I've watched The Last of Us, yeah, but I got a little bored with it. I've been watching a new stream called Lost.
Oh yeah, that's a good show.
They're on a plane, like on an island. They crash a plane. It's pretty good so far.
That's good.
Have you watched the whole thing?
Yeah, I did watch the whole thing.
Don't tell me.
I thought the acting was pretty good.
I thought the acting is good, but it's entertaining.
Oh, we got a question
Uh-huh.
coming from Charlie once more on YouTube,
Sure.
asking, until recently, you were the only surgeon I knew about doing an endoscopic approach to the cervical spine. Are you familiar with Dr. Shen in New York/New Jersey? Big difference, no laser, burrs, and high-speed drills. Oops, that should have said an anterior approach in the last question. Oh yeah. Are you? I knew about doing an anterior endoscopic approach to the cervical spine. Are you familiar with Dr. Shen?
Yes, I know Dr. Shin, and I am not the only surgeon in America that does anterior cervical endoscopic surgery, but I'm the only one who does the Duke laser disc repair. The other procedures that they do are far worse than my procedure. They're absolutely unnecessary drilling, the uncinate process. They do, of course I could do all that if I want to, but I choose not to do it because it's not effective. It's not a good surgery. I choose the very best surgeries for my patients. All right? So they don't have the ability to do what I do, and maybe they don't even know how to do what I do. But I know how to do what they do, and I choose not to do it because it's not very effective. It's not a good approach. Yes, it's endoscopic, but it's not the same as what I do. And they don't have the cure rate that I have. I have 100% cure rate of neck pain from a disc. And my radiculopathy cure rate is pretty damn close to 100%. So you can't get better results than what I do with the laser. If there was a better result, I would switch to that treatment. For me, it's all about results. For the patient, patient results, that's what matters. And I'm targeting the symptoms of neck pain, arm symptoms, weakness, numbness, tingling, and myelopathy. So 3 things: neck pain, radiculopathy, myelopathy. That's what surgeons, all patients want cured, is neck pain, radiculopathy, myelopathy. And that's what surgeons want to cure. And the surgery that provides the greatest cure in the neck for all of those symptoms is the Duke laser disc repair. There is no better treatment. So yes, I know Dr. Shin, and I'm aware he does anterior cervical. I don't think he does anywhere near as much as I do. But his results are nowhere near as good as mine, because he's using a flawed technique, a technique that's not good. I think if Dr. Shin did what I do, he'd have as good a results as I have. There's nothing magic about my results and my surgery. I broadcast it for everybody to see, including Dr. Shin. The fact is, they choose not to do my surgery, probably because they don't understand its value, or maybe they don't have the right equipment. Maybe they don't feel comfortable using a laser in the neck. I don't know. Whatever his reason is, he has his reasons. Maybe he can't get the money, get it paid for, you know? That's always an issue for us as doctors, is getting the insurance or the patients to pay for the surgery. And maybe he relies on insurance company payments for his business. I don't. I do what's best for the patient. I don't do what's best for the insurance company. And what's best for the patient, sometimes it's not covered by the insurance company, and you have to do it anyway, because that's what's best for the patient. So a lot of doctors, there's a herniation, good size. A lot of doctors do what the insurance companies want them to do. All right? And the problem is, I used to be that way. I mean, a little bit, right? I would always try to get my surgeries approved by the insurance companies when I was doing laminectomies and fusions. And the truth is, it was really easy back then. Back in the early 2000s when I was starting out, it was easy to get the surgeries approved, right? With the fusions and the laminectomies and discectomies. But now, the insurance companies are routinely denying these standard treatments, and they're just trying to save money and be more profitable, which they're already way too profitable. They should be covering more treatments for patients. There was a Wall Street Journal article that came out February 12th of this year that basically there's 850 million denied, doctor-ordered denied treatments and tests every year in the United States. 850 million. That means the insurance companies are saying no to the doctors 850 million times. 850 million times. Now there's only 1 million doctors in America. We're done with this disc. I need 1 minute, we're done. There's only 1 million doctors in America. So if there's 850 million denials, that means that the insurance companies have denied each doctor 850 times on average every year. Think about that. And that's true. I think that's absolutely true. And of those 1 million doctors that are registered and licensed in the United States to practice medicine, I think probably only half of them really have active practices, maybe 2/3. So you're talking about the active doctors that are really seeing patients in their office routinely and treating patients. Those doctors are probably getting over 1,000 to close to 2,000 denials for their recommended tests, treatments, medications every year. So it's a real problem, is the insurance companies don't want doctors spending their money, their insurance company money, to take care of patients, even though that's what it's supposed to be for. So I learned a long time ago that the insurance companies are basically evil. They don't want to help patients. They're just out for making profit for themselves. And I stopped trying to keep them happy by doing what they want me to do, which is nothing. They want me to basically just send the patients to physical therapy, which doesn't work, and have the patients pay out of pocket for physical therapy, right? That's what they want. The insurance companies don't want to spend any money on the patient. So over the years, they've basically developed a system where for physical therapy, they tell you have to go to physical therapy if you have back pain. But then again, they don't pay. What's going on? They don't pay the physical therapist. They basically, you go to the physical therapy office, you pay $50, $60 a visit. That's how much they're getting. They're not getting any money from the insurance company. If anything, they may get $5. So then they get paid $55 for your visit. 50 from you, 5 from the insurance. That's ridiculous. The insurance should be paying for the visit, not you. But the insurance companies are sneaky, and they've basically transferred all the financial risk to the patients. They make you guys pay for your care now. And they keep all those premium dollars as profit. All right, we're done. I'm happy with that. That tear will heal itself. It's going to take about a year to fully heal. But if I had to say, L23 was the most recent herniation. And the other discs were pretty badly degenerated, but L23 is a more recent one. All right, any questions from the audience?
Yes, we got one question coming from Suzuki on YouTube.
Suzuki, nice to meet you.
At-
Sounds Japanese.
I think it is. Asking, does your organization accept New York City's workers' compensation cases?
Yeah, we will take a New York City work comp case as long as the insurance company signs an agreement that they're going to pay for the surgery at our rate. So in the past, New York City was easy to deal with New York City work comp because they would do that. But more recently, the New York City work comp has changed the laws for workers' comp, and now they're trying to get out of paying for things. Let me do it. All right, any questions? Pressure?
Yes, one more question coming from Charlie, once more on YouTube, asking, as a patient, is it possible to get a written/signed guarantee of reimbursement? I have Aetna. Do you believe Medicare will cover your surgery? It would save money for goodness sakes.
Yeah, the surgery definitely would save money, but we do not provide you any written guarantee that your insurance will pay for your surgery. That's something you should ask your insurance company to give you, not the doctor doing your surgery. All right.
And at this moment, no current questions.
Yeah, it's a fair question, but we just don't offer a guarantee that your insurance will pay. But I like how you think. All right. You're going to need to take the scope from him. We can't get it disconnected from the camera. What's going on there, Luis? Is that the scope? I mean the camera or the scope? All right, we're going to end the stream, come back. We're going to be doing the